everyone, this is Musliha from final year group 5B. Here I am representing the topic AIDS. AIDS or acute immunodeficiency syndrome is caused by human immunodeficiency virus or HIV. AIDS is a final stage of HIV infection which targets the immune system of the body, particularly the helper T cells. When bacteria or viruses invade into the body to cause an infection. During a HIV infection, the virus primarily infects the helper T cells, making multiple copies of itself which then go to infect other helper T cells. Destroying a load them in the process, weakening the immune system. This makes the body vulnerable to other infections, which are collectively known as opportunistic infections. Symptoms. Within 1 to 4 weeks of infection, these symptoms may appear lasting from 3 to 14 days. Fever, rashes, sore throat, swollen lymph nodes, and fatigue. After the first symptoms disappear, most people, even without treatment, have no symptoms or occasionally have few mild symptoms. This interval period may last from 2 to 15 years. The symptoms that most commonly occur during this interval include swollen lymph nodes, felt as small painless lumps in the neck, under the arms, or in the groin. White patches in the mouth due to candidiasis, shingles, diarrhea, fatigue, fever, sometimes with sweating, progressive loss of weight, and anemia. For some people, the first symptoms are those of AIDS. AIDS is defined as the development of very serious opportunistic infections or cancer. These infections cause symptoms depending on which organ is affected. If the lungs is affected, people may experience fever, cough, or shortness of breath. If brain is affected, the people may experience headache, weakness, loss of coordination, deterioration of mental function. If digestive tract is affected, the people may experience pain, diarrhea, and bleeding. Some of the opportunistic infections associated with an HIV infection include meningitis encephalitis, pneumonia, especially pneumocystic carni or TB, chronic diarrhea caused by parasitic infections, cancers such as Kaposi's sarcoma and lymphomas. Transmission. Unprotected sexual contact with an infected person, injection of contaminated blood, transfer from an infected mother to a child before birth, during birth, or after birth through the mother's milk. Medical procedures such as transfusion of blood that contains HIV, procedures done with inadequately sterile instruments, or transplantation of an infected organ or tissues. The diagnosis technique used for the presence of HIV is called enzyme-linked immunosorbent assay or ELISA. Treatment of HIV infection is possible through the prompt initiation of antiretroviral therapy, which decreases the viral load in the body, although not completely eliminating the virus from it. Some of the most commonly used antiretroviral drug classes include nucleoside reverse transcriptase inhibitors, non-nucleoside reverse transcriptase inhibitors, protease inhibitor, and integrase inhibitor, which interfere with the creation, assembly, and spread of new viruses, and entry inhibitors would prevent the virus from attaching to the cell surface of gain entry. A combination of these drugs classes routinely prescribed by physicians To treat HIV is non-hard or highly active antiretroviral therapy. Efficacy treatment is tested through regular blood tests which measure CD4 count or the number of helper T cells in the blood sample provided. Prevention. We have often heard to saying prevention is better than cure. This is very much apt in the case of AIDS as there is no cure once the disease reaches at the particular stage. The only thing we can do is prevention, and how is that achieved since ages? The most frequent mode of transmission of HIV is through sexual contact. Thus, avoiding unprotected sexual intercourse is the best way to prevent transmission of HIV. The other frequent method of transmission includes blood transfusion. So, getting blood transfused without a prior examination should strictly avoided. Also, the spread of HIV through blood becomes possible with the use of syringes or equipments which are already used. Thus, reusing syringes for medications or even sharp instruments like razors for personal use should be avoided. And lastly, HIV easily passes from a mother to her child during pregnancy or delivery or through breastfeeding. Thus, proper medications and measures that will prevent the transmission of HIV to the child should be carried out. These are a few methods in which transmission of HIV infection can be prevented.